Hi there, this is Dr. Rahul Desai. We're going to be talking about the importance of follow-up visits. So what can you expect for a follow-up visit after you've had an injection or a therapy? The questions that we're going to ask, number one, is was it an effective therapy? Did it help with your symptoms, both pain, function, and it kind of depends on whether this was a regenerative type of therapy or a diagnostic and then potentially therapeutic injection, say like a anesthetic and steroid or a low-dose dextrose injection. If it's that type of injection, usually we're seeing patients back at around 2 weeks. And that's where the pain diary is so important that we're going to look at that. And immediately when we're doing these injections, why we call them diagnostic injections, we're very focused. We're putting a small amount of medicine into a very specific area, so into a facet joint or an epidural space or a joint. And immediately there is anesthetic effect. So in the cocktail of medicine that we're injecting, there's anesthesia, so you should feel immediate pain relief. If that's the case, then that means that we're barking up the right tree. The joint that we've treated is actually a pain generator or pain generator, one of the main pain generator or one of them. The benefit of that is we understand that if we need future treatments, we have our target. After that, the longer term, and why we wait about 2 weeks to do the follow-ups, is that we hope that it's potentially therapeutic, meaning the other medicine that's in that cocktail can kick in and then hopefully give you some long-term benefit. So we want to see that. So just because the medicine is not working when you come in and see us at 2 weeks doesn't mean the injection was a failure. It might actually be a success, because if we look back on your pain diary and for the first 4 hours after the injection you felt fabulous, then we know we have the target. We may not be treating you with the right medicine, and that's when we can discuss what are the other treatment options. Now that we've found the pain source, how do we treat it? Is it maybe the steroid is not the right treatment? Maybe we need to look at a regenerative medicine. Maybe we need to look at radiofrequency ablation, any of those things, but we've done a lot of the work by finding the source. And so that's one of the main things that we're going to look at with our follow-ups. It also allows us to document the follow-up visits, also allow us to document for insurance purposes that we did find the pain generator or pain generators. And if we ever need future treatment, then it makes that easy. So if we have treated you, you've had fabulous success, you thought this is fantastic, I feel really good, and unfortunately 6 to 8 months later, that same pain comes back. If we haven't done a follow-up visit, so if you had that injection and decided, I'm feeling so good, I don't want to do the follow-up visit, and 6 to 8 months later the pain comes back, then we're going to have a challenge to get that injection repeated, right? Even though it may be really effective, even sometimes if it's a couple of years later, then we have to go through that whole process of seeing you again, getting it authorized, potentially even having to do more diagnostic injections. So it saves us a lot of work and saves you trouble in the future. So hopefully you have a good understanding of why we want to see you and the importance of follow-up visits. We hope to see you soon.